today. But I'm grateful that you're here, and welcome to my practice. I'm Dr. Daniel Marsh, and I have been in the wellness business for 40 years now. I've been here in Tucson for about 6 years. We have one of the top wellness nutrition practices within 3 states of this area. So I love what I do, and I love getting the message out. And I'm excited for you because you're really about ready to embark on a whole new health chapter. I have seen so many patients turn their health around by starting with this 21-day purification. It's an amazing way of kind of jump-starting your health, getting you detoxified, and getting over some chronic things. A lot of people come in and they've got gut issues. That's very, very common, and we specialize in that. They have brain issues. They have chronic inflammation. And the medical route, when you think about it, is pretty dismal, right? What do they have? They've got anti-inflammatories, which we know cause more problems long term. They've got pain medication, which you don't want to be on for any length of time. Non-steroidal anti-inflammatories cause more gut dysfunction and just rip your stomach apart. This also wrecks your kidneys and your liver. So our goal is to help educate you, get you motivated to start making the right choices. And also what's amazing with this 21-day cleanse is as your body rids itself of toxins, you suddenly stop craving the food that's bad for you. And your body naturally gravitates towards more healthy choices. So we've seen amazing things happen. And I can tell you that it started, this whole health decline in our country started a long, long time ago. You're familiar with the food pyramid, right? And this came out from the USDA. And look what's at the bottom. I know, it's funny now, right? But, I'm telling everybody all day long, eliminate pasta, bread, white potatoes, and rice. And they're telling us that's what we should be consuming the most of. So really, we need to flip that thing over, and you'll learn a lot about what we recommend here and what really works best. But, our foods have been wrecked for many, many years. Is anybody here familiar with the company Standard Process? It's a nutrition company, of course you are. It's the original vitamin company. It's one of the main companies we use. They were founded in 1929. There's a 1,000-acre organic farm in Wisconsin, in Palmyra, outside of Madison, and they've been farming that land organically since 1929. It was founded by a dentist, Dr. Royal Lee, who was really never practiced dentistry, but he was an inventor and a real genius and an innovator in the nutrition world. And he started this company, and it is the elite, even today, the premier whole food nutrition company. So a lot of the products we use, and this particular cleanse is all Standard Process products. So these products have come from the farm. I've been to the farm twice, and it's amazing what they do. They have it down to a science, and lots of other people who want to do organic farming come to them for advice and instruction on how to really get it right. So I'm proud to say that I use a lot of Standard Process products. I have been on the products for 40 years. I'm really 89 years old. So let's see what you have to look forward to. He's going, no, he's not. So anyway, the products are great, and they really work. And we'll go through some details on what's in the cleanse and how it all works. But I first want to start by talking about what does it really mean to be healthy? Because a lot of people have interesting ideas of their conception of health. And I can tell you what most people tell me is that health means I feel good, right? Would you say that's one of the main things? You want to feel good. Mm-hmm. But did you know that your level of health has nothing to do with how you feel? Did anybody here get COVID?
Yep.
Okay, so how did you react to COVID?
I almost died.
Did you? Yeah, I'm sorry to hear that, but I'm glad you're here.
Yeah.
But a lot, and you probably felt pretty good before you got COVID,
Oh, yeah.
right? So those people that really struggled with COVID and unfortunately didn't make it through had underlying health issues they didn't even know were there. And I use the example of heart disease frequently because what's the most common first sign of heart disease? That's a good guess. High blood pressure. How about sudden death?
You don't know.
Yeah, 40% of the population who have heart disease won't know it until their heart suddenly fails. So you can have all of these things going on, even with cancer. We all know somebody who felt great. They went to get their regular exam. They found some weird things on the test. They did more tests, and they found out the patient's got stage 4 cancer, and they got 6 months to live. But they felt fine, right? So these are silent killers we're dealing with. And all of these things, even diabetes, obesity, heart disease, they're all related to lifestyle. So you can have a lot of things going on and not know it until suddenly you're hit with an immune challenge like a virus, or you go through a big stressful event and all of a sudden your body crashes. Our goal is to not get you when you're in the sick care model. I mean, we enter the health care model, which is really the sick care model, when we're sick, not when we're healthy, right? But what we do here is try to help educate patients and think differently, change their paradigm about what it really means to be healthy. We want all of your organ systems, glands, and tissues to function 100% all the time. That's what health is. And we do that through chiropractic care and through nutritional therapy. Now, the nervous system, that's the central nervous system, the brain and the spinal cord is the master computer that controls everything that goes on in the body. Has everybody here had experience with chiropractic? Most people have, hopefully a good experience. So restoring nerve supply by doing spinal adjustments and correcting subluxation is one major aspect of getting your body to function and be healthy. But balancing the body chemistry is a whole nother component of being healthy, because there's nerves that come from the brain down the spinal column and out to the organs, glands, and tissues. There's other nerves that go from the organs, glands, and tissues back to the spine and back to the brain. So there's constant feedback going on between the brain and the body that helps to maintain what's called homeostasis. That's health. You can have a biochemical imbalance, let's say in the stomach, which is very common, and there's nerve endings that will pick up that biochemical imbalance and send messages back to the spine and cause the spine to subluxate or misalign. You all know what a subluxation is? You ever heard the term? If you've been to a chiropractor and you don't know what a subluxation is, then they have not educated you. What's that?
Wrong chiropractor.
I'm sorry?
Wrong chiropractor.
Oh, yeah, there you go. So this is a takeaway segment of your spine. It shows the vertebra, the disc between the vertebra, and there's spinal nerves that come out right behind that disc. These joints are supposed to move in a certain number of directions. A subluxation is a situation where a vertebra gets stuck out of position. It's choking off that nerve, putting pressure on the nerve. That's going to reduce nerve impulses to that gland and tissue and affect the function of whatever that nerve goes to. When you get adjusted, we are unlocking, adjusting, restoring joint mobility, correcting the subluxation. That immediately takes pressure off the nerve, restores nerve supply to the tissue, and that helps to promote healing. That popping sound you hear is just gas moving around in these joint spaces in the back. And so patients can have a subluxation for years with no symptoms. So chiropractic was never meant to be a pain relief method. It's all about restoring nerve supply so your body can function 100% all the time and be ultimately healthy. So that's what a subluxation and correction is. But you can be adjusted and adjusted and adjusted and never stabilize because there's an underlying organic problem. And that's where the nutritional therapy comes in. You can have a problem with the detoxification organs, and we'll talk about what those are. You can have, like I say, stress on the digestive system. A lot of people come in with an issue with stomach issue with heartburn. Anybody here ever had heartburn? Okay, so when you get heartburn, what do? You go to the doctor and say, I got heartburn. What do they do?
Prilosec.
Prilosec, omeprazole, and antacid. So what does that antacid do? It neutralizes the bad acid that's causing the pain, but it also creates more problems down the road because your stomach is normally supposed to be very acidic with the right kind of acid called hydrochloric acid, or HCl. But what happens with a bad diet and a toxic body is the pH comes up in the stomach. You don't have enough hydrochloric acid in there to break down the food, so the food sits and rots in the stomach. That rotting food produces a different kind of acid, 2 of them actually, that reflux causing heartburn. So when you take an antacid, you get immediate relief by neutralizing those bad acids, but you continue to not digest your food because those drugs are neutralizing what little good acid is in there to digest your food. And then ultimately, so your body's in its own digestive malfunction is throwing out more toxins, making you sicker even though you feel better. And eventually you end up with lower bowel issues like colitis, diverticulitis, irritable bowel syndrome, colon cancer. A lot of the patients come in here and their main complaint is they've got lower gut issues. And I'll tell them it all started up here, actually. And sometimes it goes even further north. Where does digestion begin? Anybody want to guess?
The brain.
You are so smart. That's right. It starts in the pituitary. The pituitary gland in the brain sends a hormone to the stomach and tells the stomach to produce hydrochloric acid. So if a patient has had a head trauma, a concussion, do you know what happens within 3 hours of a concussion? Within 3 hours, a patient has leaky gut syndrome. So there is a definite connection between the brain and the gut. Maybe you've heard that before. But anyway, so if a patient's had a huge emotional or physical stress on the body, that affects the pituitary and will lead to chronic digestive issues down the road. So, by the way, one of the best forms of care for undoing the negative effects of concussion are chiropractic. There's nothing out there that's better than what we do for overcoming symptoms of concussion. I see lots of patients with concussion, traumatic brain injury, all kinds of those issues that they've had for years, and nobody's been able to really identify it and correct it. And they come in here and we see miraculous things happen. So anyway, a stomach problem can start in the brain, or it can start here, or it can be a dietary issue, and then eventually it's going to cause lower bowel issues. So any questions on that? If you guys have any information or any concerns or questions, please feel free to chime in. I do want to talk a little bit about the nervous system. The autonomic nervous system has two branches. There's the sympathetic and the parasympathetic. This is the part of the nervous system that controls everything that goes on in your body without you being aware. You don't have any control over the autonomic nervous system. There's the other nerves. You have motor nerves that control muscle function and movement, and you have sensory nerves that transmit pain and sensation and temperature. But the autonomic nervous system pretty much governs a lot of things that go on that thankfully we don't have to think about or control. And there's the sympathetic and the parasympathetic. Those are the two sides of it. The sympathetic branch is the fight or flight reactive side. That's when your body's under stress, or you've gone through a trauma, or somebody's chasing you, and it keeps you alive in a dangerous situation. And then there's the opposing side. This is the parasympathetic. This is where you down-regulate, where you rest and digest and heal. A lot of people come in and they're stuck in this sympathetic mode. Anybody know somebody who's like can't relax, they don't sleep well, they're just in overdrive all the time? It's common. It's really common. And guess what? Unless that's identified and corrected, the patient will never get well. No matter what you do, you won't get the results you're hoping for. It actually creates what's called a paradoxical reaction when it comes to medication and nutritional support. If you take a drug, you're supposed to get a certain response. Patients who are sympathetic dominant will have an opposite reaction to what they're supposed to have because the nervous system is in disarray, it's confused. So through the techniques, the specialized techniques we use here in this practice, first thing I check when I'm examining a patient is to find out if they are sympathetic dominant or not, or does the body know how to downregulate? Because if we don't identify that and correct it, no matter what we do, it's not going to help. So the first thing we check is that, and one of the most common symptoms of a patient who is sympathetic dominant is they can't shut their brain down at night. They don't sleep well, or they wake up. Is that you?
Yeah, that's me. Yeah, you started to explain a little bit. I was wondering, how do you diagnose or figure out whether it's a sympathetic
That's
issue?
a really good question. I use a technique called muscle testing, and it's a way of using your own body's energy to find out where the biochemical imbalances are. And I'm pushing down on your arm. We look for a nice locked, strong muscle, and I touch certain areas of the body, and we look for weakness. If there's this very specific test we do through the muscle testing that tells me if your body knows how to downregulate or not. It's using your own body. It's kind of a mixture of reflexology, acupuncture, and applied kinesiology, because we're using your own body's energy to kind of read what's going on. A good muscle tester, by the way, and I've been doing this for 40 years, can find things that won't even show up on blood tests. So maybe you're aware of muscle testing, maybe you're not, but some people, when I first start to do it, they look at me kind of funny. but then they start seeing the results, and then all of a sudden and you know, we use acupuncture points. Acupuncture was discovered by the Chinese, 4,000 years ago? So the energy work is not new, it's just not mainstream. So that was a very good question. Hopefully that clears it up for you. And it just takes seconds, it's very, very quick. There's no blood test, there's no medical diagnostic test really to tell if a patient is sympathetic dominant. We take a detailed history, and that gives me a lot of information about you, and then we do the muscle testing, and we have some other technologies that we use to also read what's going on with you internally. We have a heart sound recorder. It measures heart valve function. We put a sensor over the 4 heart valves, and it gives me a lot of information to determine if you have nutritional deficiencies affecting your heart. And so that also tells me kind of if you're sympathetic dominant or if you've gone through some heart trauma. We see a lot of people with broken heart syndrome. I don't know if you've heard of that before, but if somebody's had an emotional trauma even years ago, it can hang with them for a long time and affect their heart, and that also affects the sympathetic nervous system. So there's just a lot of things we can uncover that very few people know how to find and fix. So that's the nervous system. What we find is through the history, a lot of people have struggled with things like they've been exposed to some of the most common problems in terms of toxicity is a lot of people are raised or have been living with well water, so they're exposed to heavy metal toxicity, or they have metal implants in their body from surgeries, that kind of thing. Fusions, I see a lot of that. A lot of people have diets that are loaded with sugar, like that. I've had patients that come in there and they drink diet soda. Imagine that. It's loaded with aspartame. You know what aspartame is?
Just the opposite. Tricks the pancreas.
Right, yeah, it makes you crave more sugar. But it's a neurotoxin. And I've actually had a patient with developed seizure disorder, and it was a younger, her mother brought her in, she was I think 17 at the time, and she was chewing Trident gum, and a lot of it, loaded with aspartame. And she was chewing gum. When I evaluated her, I said, "What are you chewing?" She goes, "I tried it." And they had just come from Costco. They had a big package of it in the mom's purse. So I took her off the gum, and her seizures went away right away. So we see a lot of issues. Yeah, patients who are on these artificial sweeteners, it actually tricks the body, like Steve said, and it makes you crave more sugar. And we're loaded with high fructose corn syrup. And our breads and grains are genetically modified, meaning they have built-in toxins in them. There's things that like yogurt. People say, "Yeah, I eat yogurt. That's a great probiotic," but they don't read the label. It's like loaded with sugar because there's fruit added to it and so on. And a lot of people are doing protein bars that are loaded with sugar too. So sugar is a big common problem. There's even those patients that tell me, "I eat organic and I do all this." Even though they're eating organic, you're living in this country that's loaded with toxins in our air, in our water, and in our food. You just can't get away from it.
I have a question right
Yes,
there.
sir.
The word of organic, and with the company that makes the vitamins
Yes.
since 1929,
Yes.
Soil can only produce so much, so how do they replenish the soil?
That's a very good point. In fact, the topsoil issue is going to be a very, very serious issue in this country because the farmers don't know how to manage. It's totally depleted. The topsoil at standard process is like 8 feet deep. In most farms, they have 1 or 2 inches of topsoil left. And once the topsoil is gone, they're not going to be able to grow any food on it.
They have to chemically.
Right. So because they've managed the farm and they've rotated the crops and they compost all this stuff and they put it
4-year cycle.
Yeah, they put it all back into the soil, and I mean I've seen it. Their topsoil goes really deep. So that's a really good point and very good question. In fact, the farm manager was at a seminar up in Scottsdale late last year. I went up there, and her and her husband run that standard process farm, and they talked in depth about the topsoil issue because there's again farmers from all around the country that come to them and to learn about how really to manage the farm properly. But then there's a lot of farmers that don't really care. They're getting paid to do things, you know.
So it caused the Dust Bowl.
Yeah, exactly. You got it.
They
Yeah.
didn't rotate and
Yeah.
burned it.
So, you know, this, I mean, 10, 20 years down the road, it's gonna be a whole different ballgame in terms of food supply. I think that's gonna be our biggest threat over
Food
anything.
and water.
Yeah, exactly. So, anybody ever seen a notice like this in the mail? Yeah, you know what this is, right?
Mhm.
So people are shoving their, or dumping their medications down their toilet, and it's ending up in our water supply, and they have no way of filtering those out. So now they're sending out notices to, saying your medications should never be flushed. They have reclamation centers for your drugs, but so many people don't get these, they don't read them, they just throw their drugs down the toilet. And so we're getting drugged by the drug companies whether we like it or not. And it's really pretty crazy.
It's crazy that you get all this medication prescribed and then you don't use it.
Oh, I
and
know.
you toss it.
I
And
know.
there are tons of people that would need it and they don't get it, they cannot afford it.
It is. It's really amazing. And, you know, we're way over medicated and we're malnourished, we're underfed. Yes.
There's a big problem with that. It's called commercialization of medication.
Oh, yeah.
The television screen, you have to have that new disease because they're telling you, we have this drug, ask your doctor.
Yeah. Oh, I know. You know. And then they list the myriad of side effects. So that, I'm gonna jump ahead here. There's a couple, so Dr. Roy Lee did a lot of writing, and this is one of the things that he wrote about. He said, the survival value of foods, this is out of a book, it says, examines the misuse of scientific facts to make counterfeit foods seem healthier than they truly are, all in the name of industry profits versus the health of the public. That was written in 1958. Yeah. I was 4 years old. Here's another one. Tempering of foods and tampering with glands reminds us of the key purpose of our glands is to rid our body of toxins, and the heaviest burden of these toxins comes from food tampering. Manipulating their natural state until they are unrecognizable by our bodies, Lee states. Here is the real stress syndrome, which is bringing about glandular insufficiency, guised in the dark cloak of seemingly unrelated diseases with a background ranging from obesity and arthritis and even mental disease. So, you know, you think about all these people that are having mental decline, Alzheimer's, dementia, early onset, all of these things, it's all food related. The number one most prescribed medication right now is a statin drug. And now the doctors are saying, if your cholesterol's right around 200, you should still be on a statin drug. When I started practicing 40 years ago, normal normal cholesterol levels were in the 250 to 260 range. And then over each decade, they kept lowering that number. So 10 years after I practiced, they brought it down to like 240 and then 230. Now they have it at 200. Why do you think they keep lowering that number?
So you'll take statins.
So they sell more drugs. But guess what feeds the brain more than any other nutrient? Cholesterol. Right. So these people, these patients that have been on statin drugs for a long time, not only are they getting all this muscular weakness because it's depleting their body of protein, their itch, they're losing their minds, literally. They're starving their body and brain of cholesterol, the food that feeds the body.
And the three has the triglycerides.
Right.
They don't fully understand it.
The triglycerides is the most important number in the whole blood panel, or the chemistry, or the lipid panel. So when the cholesterol gets low, that fat is important not only for brain function, it's important for immune support. Your body needs cholesterol for that. Every cell in the body has a lipid layer that protects the cell from viral attack and bacterial attack and free radical attack, that's cancer. There's all of your hormones are manufactured from cholesterol. So, there's so many different health issues that can happen as a result of cholesterol that's too low. I have patients coming in and with the cholesterol, their numbers are down to like 130 or 140. But if a patient comes to me and they're not on a statin drug and their cholesterol is that low, the first thing we think of is they have cancer. So you do not want your cholesterol that low. I have so many people who come in, they want off the drugs. Unfortunately, I'm in a position as a chiropractor that I cannot advise them on the medication, but I can help them balance the body chemistry so there's less of a need for the drugs, and then they go back to their doctor and say, I want to down dose on these drugs. High blood pressure medication is another common one. Patients come in and they're on 2 or 3 hypertensive medications. So the doctors put them on one. If that doesn't work, then they add another one to it. And then if that doesn't work, then they add a third one to it. And so a lot of times patients have hypertension because of liver congestion. The liver is your main detoxification organ. If it gets congested, it's going to bring up your blood pressure. We have a functional medicine test here that we do, and I did it today with a gentleman. His blood pressure is really high, and we gave him this product called Antronex, which helps to enhance liver circulation. Had him sit for 15 minutes, rechecked his blood pressure, and his diastolic number dropped about 40 points in a matter of 15 minutes. And this guy owns a extermination company, exterminator. So he's been around toxins for 40 years himself, and of course he's going to have this huge body burden. And so, you know, unloading those chemicals out of your body is extremely important to get all of the systems in your body functioning normally. Any questions before we move on to the cleanse? You guys have good questions. I appreciate it.
Is there a cure for Bell's palsy?
Bell's palsy is inflammation of the cranial nerve to the face,
Mhm.
and one of the most common causes of that is a subluxation. Remember the term? Subluxation, misalignment of the upper cervical vertebra. This is the back of the skull. Here's C1 and C2. When the atlas subluxates, it affects the brainstem up here, and that can cause Bell's palsy. Another common cause is just inflammation around the nerve, and that can be an immune challenge. And again, through the muscle testing, we can kind of decipher what the root cause of it is. I have lots of patients coming in with vertigo as well, and vertigo almost always has to do with a chronic underlying immune challenge in the head and neck area, and it can be chronic sinusitis, which has its root cause in a gallbladder dysfunction. So that's where the cleanse helps to clean out liver, gallbladder. We can save gallbladders through the cleanse, but it just unloads that immune challenge, whatever it is. So, you know, we don't really treat all these conditions. We balance the body chemistry. We feed the body nutrients to keep it healthy and to rid itself of all of these challenges, and then we see miraculous things happen with it. So, I don't treat cancer, I don't treat heart disease, I don't treat high blood pressure, but when we get to the root cause of these things and treat them naturally and support the body naturally, then that's when we start seeing major changes.
Can I just ask you?
Yes.
What's happening to your body when you have UTIs?
One of the most common causes of that is not bacterial, but the doctors will treat it with an antibiotic, which perpetuates the problem. It's usually fungal. It's a yeast. And yeast happens when a patient's been under a lot of antibiotics, and then they start, the yeast thrive on sugar. So you start craving sugar, and you're just basically feeding the beast, and they just keep recurring. So again, that's related to kidney issues as well. And your kidneys are one of your main detoxifying organs also. And so this cleanse helps to flush out your liver, your kidneys, your lymphatic system, your lungs, and then patients all of a sudden start, have the ability to fight these things off. But chronic UTIs can be a big problem. And chronic inflammation, I have a sheet here on that. Chronic inflammation is the silent killer. Most common causes of chronic inflammation: immune challenges, which is yeast, bacteria, virus, or a parasite. That's another issue it can be. Prolonged use of anti-inflammatory drugs, excessive carbohydrate consumption, that can be sugar, alcohol, pasta, bread, white potatoes, and rice, like on the food pyramid. Chronic spinal subluxations, misaligned vertebra. Trauma and concussion, we talked about the brain trauma. Heavy metal toxicity, upper digestive dysfunction, prolonged emotional stress and worry, GMO foods, glyphosate, hormone imbalance, adrenal fatigue, excess estrogen. Estrogen we're swimming in estrogen. It's in our foods. They use it as growth hormones in a lot of the meats. And if any of the women out there are using any facial or skin products that are anti-aging or wrinkle-free, they're loaded with estrogen. That's the active ingredient. And they don't have to
So it's good
live.
for the outside, but bad for the inside.
Exactly. But what are we most concerned about? What's on the outside, right? Yeah. Doesn't matter how sick you are, as long as you look good. This is a big one too. Excessive consumption of bad fat. So anything that comes in a bag, bottle, or a box is going to be loaded with hydrogenated or partially hydrogenated fats and oils. And for men with prostate issues, that's usually the culprit. That chronic inflammation leads to chronic prostatic inflammation, which then leads to prostate cancer. Antacid use, we talked about that. Food allergies, a lot of people are loaded with food allergies because of liver congestion. Anybody here had an allergy test, blood or a pinprick test? Yeah, and you come back with a list of this long of foods you're not supposed to eat, right? So what do you eat? Every time a patient's done that, they bring me this list and I think, how are they supposed to live?
Right.
You know? So when a person's that sensitive, there's a root cause, and it's usually the body just has a huge toxic burden, and we have to unload it. And when we unload that burden, all of a sudden they're not so sensitive to all these things.
But a lot of it does reflect on the immune system.
Yeah, and the immune system is on overdrive when they're super toxic, especially the liver. There's antibiotic syndrome, that's kind of what we're talking about a little bit, and then leaky gut syndrome. Again, the most common cause of leaky gut syndrome is two things: brain trauma, concussion, or chronic digestive problem that has not been corrected or that's been mistreated. You guys are awesome. Any other questions before I move on? Okay. So let's talk about the cleanse. Everybody needs to detoxify, that's a given. We're loaded with processed foods, non-organic foods, genetically altered foods, artificial sweeteners. We've talked about all of this stuff. And anybody who does their own home cleaning, they're using cleaners. If they don't filter their water, they're exposed to iodine, halogens, fluoride, that kind of stuff that wrecks your, chlorine and fluoride that wrecks your thyroid. So what happens when we do start to detoxify is patients get more energy, they naturally lose weight. This is not a weight loss program, but the natural byproduct is the average person loses 12 to 15 pounds in the first 3 weeks. And I've had patients that have repeated it 2 or 3 times in a row because they were feeling so good. I had one gal did it 2 times in a row, 6 weeks, she lost 56 pounds in just 6 weeks, just by doing the cleanse and making some basic dietary changes. So it's pretty amazing. Improved mental clarity. A lot of times patients have brain fog because of the chemical overload. Heavy metal toxicity oftentimes will cause brain fog. And one of the things that always coexists with a heavy metal toxicity is a candida, a yeast issue. So those two always go together, and we pick that up through the muscle testing, and we always address both of those together. And we see amazing things happen. I'll tell you a quick story. I had a guy who was in his late 70s when he started with me. He was a farmer from Ohio, and he actually was a professor here at U of A. He was a soil expert. And when he was a kid, he was 18 years old, he was out with his buddy in the fields in Ohio, the cornfields. They had their shotguns and they were goofing off. His buddy, on accident, shot him in the leg short range with all this lead buckshot. And he survived it, but they couldn't get it all out. They left it in there. Well, early on, like in his early 70s, he started getting Parkinson's and started early signs of Alzheimer's. And I muscle tested him, and sure enough, we found the heavy metal toxicity in there, and we treated him for the lead and started unloading some of those burdens. And then shortly thereafter, within like 6 weeks, he went back to Ohio for a reunion, and the family members couldn't believe how much better he was cognitively. He could carry on a conversation. He was aware. It changed everything once we took some of that burden off of him. We couldn't get rid of the lead, but we could at least unload some of the toxins. So it's really powerful how those heavy metals can really affect you adversely, and affect the brain. Sex drive, overall well-being, all those things are affected. And one of the things that happens too is, remember I said you don't crave the foods that you normally do crave that are bad for you. When we get rid of these toxins, you suddenly don't crave sugar anymore. And that's pretty awesome. It's really hard to get off sugar for a lot of people. These are whole foods. Like I said, ingredients are harvested at the peak of their nutritional value. They have unique manufacturing processes where they use low heat and high vacuum. I've seen their dryers that it takes a long time for them to dry their foods, but they don't do anything with high heat that destroys the active ingredients. We want to purify, renew. There's several products, but these are the glands of detoxification. We talked about it. The liver, the digestive, the gut, the kidneys, the lymphatic system, and your body can hold on a lot of toxins. So there's phase 1 and phase 2 of the detoxification process. Phase 1 is where your body starts to package up those toxins, and phase 2 is where your body can actually eliminate them. It's one thing to package them up, but if your body can't get rid of them, that's a key problem. And one of the things that really helps with the elimination through this whole process is hydration. You have to drink a lot of water during this whole process. They recommend that you would drink half of your body weight in ounces every day of water during this process. And if you're feeling crummy within the first 48 hours, you drink more water.
Is this where the waterhead comes from? Is this where the waterhead comes from?
Yes, exactly. Exactly. So hydration.
Excuse me.
Dilution is the solution to pollution. Yes.
And filtered water?
Yes, you want to drink good quality water. Yeah, definitely. We have an RO system underneath our kitchen sink, and so we always drink that, and we have bottled water here. So yeah, drink good quality water. Super important. Any questions on anything so far?
How is the Tucson water rated?
It's very high mineral content. I mean, you see that all over in your home probably if you don't have a filter. Yeah, it's loaded with minerals. That's why there's so many mines around here, loaded with minerals.
Do they have fluoride in the water?
That's a really good question. Fluoride?
Because they don't always do.
Right. I don't think they fluoridate the water here, to be honest with you. They did when I lived in Northern California. They used to do that, but I think they fought it here. I'm not sure. So there's two components to this cleanse. There's the powdered shakes, and then there's supplements you take. The powdered shakes, it comes with loaded cruciferous vegetables that come from the farm. It's powder, and you can do 2 to 3 shakes a day, and there are shake recipes in the book that we'll go through. And then there's supplements you take. The first one is the SP Cleanse. These are capsules that you take 7 of them 3 times a day. Let's go to that. Cleanse. SP Cleanse. There are herbs in there that are designed specifically, again, to help detoxify your kidneys, your liver, and help to promote kind of a diuretic cleansing process out of the kidneys. Burdock, this is a product that's been around for many, many years. It's been used for treating men with prostate cancer. We don't make that claim, but all of these are done. This is fenugreek is really great for mobilizing mucus out of your body and excess cholesterol out of the blood vessel walls. Spanish black radish is really powerful for detoxifying the lower bowels and also helping to pull excess estrogens out of your system. That's one of the major positive side effects of this cleanse is you're going to pull those excess hormones out of your system.
Could you go to the slide prior?
Pardon me?
Could you go back to the slide that was just before this?
Sure.
It flashed. No, not that one. It had, yeah, that one. Okay.
Yes. Oh, that's the powder. So let's go here. That's the SP Complete. So There's a little bit of whey protein, the buckwheat, barley grass, alfalfa, brown rice. These are all designed again to help promote cleansing of the blood and just starting to pull toxins out. This stuff really works amazingly well. And I've had, again, through the cleanse and cleaning out the blood vessels, I've seen patients drop their blood pressure dramatically with it. Okay.
Are these separate capsules or is it all combined?
They are, they're small capsules, they're separate. So the first week, you're gonna go through the SP Cleanse capsules. You take, if you can, 7 of them 3 times a day. Might seem like a lot, but they're small little capsules. But that really, I mean, I've done this cleanse so many times, and I can tell you, there was a time when I weighed 50 pounds more than I do. So I've been there, I know what it's like to be really heavy. I had a practice in Ohio for about 3 years, and I was eating the way they did and not active, and I had a Dairy Queen next to my office, and I'm confessing, okay? But I saw what happens when you don't take care of yourself. It just adds up, and all of a sudden you get all these, my blood pressure was high, and this was like 30 years ago. And so, thank God I got out of Ohio, moved to Northern California for 20 years, and changed everything up, started really getting serious about this, and now I'm 68 and still going strong. So
54 was a good year.
yes, it was, wasn't it? All right. So and then on the second week, Jan, through the third week, you're taking SP green food capsules, 5 of them just twice a day. So it gets easier. But the first week is really powerful. That's when you really start seeing an amazing positive change happen.
So you're just having the shakes?
You're doing the shakes and the supplements.
Right, and nothing else?
No.
And water?
No. There's more. But wait, there's more.
I have a question.
Yeah.
Yes.
To get on, if you go on this program, if you're already taking a lot of these supplements, should you stop them to do
What
this,
we do
or
is I'll
are
go
you
through
on
and
it?
assess what you are taking, because you're not taking stuff from me, I don't think.
No, but I take a lot of the.
Okay, so you can dial down, and if you're taking a lot, but you really need to take those, because I have no idea what you're taking,
Yeah.
I would say cut those doses in half, and then add these in. And then what I do, if you're a patient of mine and I already have you on a lot of supplements, I'm gonna really dose down, have you do the cleanse, and then reassess you after the cleanse, because there will be less of a need for some of those products. Yes?
Yeah, talking about this, I'm just kind of curious. Is this diet good in all cases, or like if you're on certain medications or being?
Everyone can benefit, and
Because like I'm on like a high blood pressure
Sure,
medication.
yeah. you keep taking your medication as prescribed. But what'll happen is, as your body cleanses, there will be less of a need for the drugs, so your blood pressure can come down naturally, at which point you go back to your doctor and say, hey, my blood pressure's come down, I want a down dose on this drug, because you won't need as much. That's not my job to do that, but I instruct my patients to communicate with your doctor, and we check blood pressures here all the time. And if I see that it's coming down, but you're taking the same dose, you're overdosing on the drug, meaning you're gonna have symptoms like dizziness, fatigue, that kind of thing. And then that's when you contact your doctor and say, I wanna change my meds. But there's no contraindication for doing this in terms of what you're taking.
Okay, or other medicines or
Any of 'em.
Anything? that-
Yeah, some people are on
Because it's
metformin
so
for
much.
sugar, and they don't need that as much, and, whatever medication you're on, you stay on it. When you're done with the cleanse, if you feel like you wanna be reassessed by your doctor, then you make an appointment
Yeah.
and get assessed and say, hey, I don't think I need as much. You can say, look, I've just done a 21-day cleanse. I feel like I'm feeling a lot better. I want a down dose on my drug.
And this primarily cleanses, you say, the blood and,
All of
the
the
liver? or-
all of the detoxification organs, the lymphatic system, that's the system that pulls toxins out of your body. The kidneys, the liver,
I apologize.
the digestive system, pardon me?
I think it's liver. sorry.
That's okay. Your digestive system will begin to heal up. You'll start naturally losing weight. Your energy will come up. You'll just start feeling better. And you'll all of a sudden, what happens is the body kind of knows what to do intuitively. So as you feel better, you'll go, you know what? I don't feel like I need this as much of this drug anymore. And then I wish I could tell you, hey, don't take them, but I can't.
No, I understand that.
Yeah.
But I just wondered if, you have to be careful about, if you start a detox, is it gonna be a problem with certain medications or anything like
The
that?
medications they're gonna be more effective because you're gonna be less toxic. You're gonna feel the effects of them more. And again, which means you go to your doctor and say, hey, I don't think I need as much. And if they don't want to down dose you, you know what to do?
Like another doctor?
Yeah. He said it, I did.
It all boils down, who is your best advocate?
Well, that's it.
We.
That's it, yeah. And more doctors these days are realizing that patients don't want to be drugged up as much as they used to. I mean, we're getting smarter. Okay?
And if you want to see a doctor afterwards, make an appointment today.
Yeah.
Because you wait forever.
Right, exactly. Exactly. Okay, so let's go here. So the SP cleanse, again, we clean out all the detoxification organs. We use a fiber called whole food fiber. It's a powder that you put in the shakes, and the fiber is really important for restoring normal gut biosis, normal gut bacteria, normal gut health. It also helps to scrub in your intestines and pull out toxins out of your gut. And it also helps to heal up leaky gut syndrome. So, whole food fiber, yeah, it's amazing. The green food, we talked about that. That helps to also heal up your digestive system. And again, a lot of people have lower bowel inflammation. Yes?
I'm sorry.
Oh.
Do you use soy in the products or no? Good.
What was that?
No.
Soy?
No.
Okay.
There's a lot of dietary companies out there that are using processed foods that are loaded with soy, and it's just,
Yeah.
we don't do it. Too much estrogen.
Mhm.
Green food. Okay, so the supplement regimen, this is for the first week. The capsules, the SP cleanse, you do those 7 of those 3 times a day, and then you do your shake 2 to 3 times a day, and the whole food fiber goes in the shake. So there's 2 schedules. There's the supplement schedule, and this is on the second 2 weeks. You change from the SP cleanse capsules to the SP green food. Everything else stays the same. That's the only difference, is that first item. Now, what to eat? Okay, so in your booklet, on the inside back cover is a tear-off shopping list. Okay? See, on the inside it says fruits, beverages. On the outside, it's vegetables, and then pseudograins and other things. So what you're going to do is you're going to make sure you have enough of this on hand. You're going to eat 2 times the amount of vegetables that you do of fruit. And I recommend, if you're putting fruit in your shakes, you really don't want to have more than about 2 to 3 servings of fruit a day. But you're going to load up on vegetables, and they can be vegetables that are sauteed or raw, slightly sauteed in good quality butter or oil, not canola oil. Use avocado oil that tolerates high heat. Olive oil you're going to put on salads. You don't heat up olive oil, it goes rancid. Eat as many as you like on the veggies. Again, they can be slightly steamed or raw. And so on the first 10 days, you're eating most fruits and vegetables, you're doing the shakes, and you're doing the supplements. On day 11, that's when you introduce your animal proteins. Okay? That's your meat, fish, chicken. And in the book, if you look on page 19, here it lists protein sources on day 11 to 21. They can be good quality fish, meat, fish, or chicken, and it talks also about the serving size. And so what's going to happen is you'll be satiated a lot sooner. You won't need to eat as much food to feel satisfied. And so this also shows you the good oils and fats at the top. Avocado oil, good organic butter, coconut oil, flaxseed oil, ghee, grapeseed oil. So you notice there's no canola oil listed there. That's highly processed, really bad for you. Okay, and so if you look on the next page, on page 21, that light gray area, this is what you're going to try to stay away from for the entire 3 weeks. Alcohol, caffeine, tobacco, other stimulants, dairy. Now there is one exception where it says eggs. I personally think eggs are great for you, and I would say eat eggs. It says here no, but I say yes. You want to stay away from grains, nuts, and any processed or refined foods. For instance, that's probably the only animal protein that I tell patients to eat on the first week. If you're feeling really weak or sluggish and you're not ready to have a full meal, have a good quality hard-boiled egg on hand. It's a great snack. It'll give you some energy. And for me, when I do this cleanse, because my job is very physical, and I'm adjusting, a number of people a day, and I work out at the gym a lot. I have to stay physically fit, and so I need that extra protein. So I will eat eggs, and sometimes I'll have a little bit of organic chicken in the early stages of the cleanse, just to maintain my muscle mass. I can't go without protein very long. So, but that's the exception. Yes?
Is the coconut yogurt, is that considered dairy?
Well, probably not.
I should look at the sugar content
Yeah,
in it.
and the
but-
source. If it's all just coconut milk kind of
Right.
thing,
Okay.
cultured, there's
I was just
it's
curious.
probably okay. Anytime, if you're a patient of mine, you can bring any food in, and I can muscle test the food on you.
Okay.
Yeah, I was just curious, you
Yeah,
said.
let's bring all the food and we have a potluck.
Okay, yeah. I'm up for that. Yes, I'm sorry.
Yeah, you said you'd make an exception with eggs, and one thing here I thought was very good, and even the oils in them were very good for you, was the nuts. You said no nuts, or?
Well, the nuts, a lot of times, unless you're getting organic nuts, you're getting nuts that are loaded with fungus, and they're usually GMO. But we're trying to get your body, give your body a break from digesting. So nuts are kind of hard to break down sometimes, and so we just have patients, and a lot of people, they love their peanuts, which are like the worst nuts to eat. They're genetically modified and they're loaded with toxins. So I eat nuts all day long. I love nuts, but
Yeah.
during the cleanse I don't.
During the cleanse, no.
It just gives your gut a break and your gallbladder and liver, because it's fat, so it's a little harder on the gallbladder.
Right,
Because, yes, Steve.
Two questions. First one, refrain from dairy during this. That means yogurt too?
Okay, there's one
Because
exception.
I take a lot of my stuff with yogurt.
Okay.
Either yogurt or applesauce.
There's only one yogurt I ever recommend anybody take, and it's a yogurt. It's a company a dairy that's from Sonoma County, where I was for 20 years before I moved here, and it's Strauss. They have whole milk, plain Greek yogurt. You can get it at Whole Foods or at Strauss yogurt. It's an organic yogurt, and that's the only one I recommend.
And that's because of the sugar in it or what?
Yeah, it's lower sugar, and it's
So instead of
better
that, just
quality.
go with normal applesauce then.
Yeah. Yes.
Do you show us at the end of this or somewhere how to reintroduce eating again?
Yes, let's move on here. So on day 11, you're gonna start bringing in your proteins, your regular good quality proteins, and you're still eating your salads and your vegetables and your fruit and your shakes. At the end of the cleanse, you basically continue on. Like I have a cleanse shake every morning for breakfast, and have for many, many years. But some people want to have, eggs, and they want to go back to eating more of their typical stuff. But you're going to stay away from things like, you're going to reduce the amount of breads you're going to eat, because it's going to make you feel crummy. When you cleanse out and you reintroduce that stuff, you're not going to like it.
You'll know
And your body will just naturally resist it. And so you just try to follow it and stay with that as long as you can. Now, I love coffee, and so what I'll do is I will start to down dose on my coffee, and if I get a caffeine withdrawal headache, I might have like half a cup of coffee just to kind of reduce that headache and then just wean off. But again, hydration, lots of water is really important. You can have all the green tea you want through the cleanse. There is a little caffeine in green tea, but it's really powerful for also detoxifying. Okay, so yeah, just you're gonna ease into certain foods that you used to eat, and you'll know your body will tell you. Really, it's amazing how it works. How am I doing? I'm way over time here. Any other questions? Steve, you're not allowed any more questions. Okay, so the eating program, we talked about that. To avoid being too hungry, again, have another shake, or you can snack on a piece of food, or you can have celery stick or carrots or whatever, just whatever you can, or have an apple. Certain fruits are lower glycemic than others, and those are the dark purple fruits. The plums, pears, apples. You want to stay away from strawberries and bananas. Those are usually pretty high. And if your strawberry is not organic, it's one of the most heavily sprayed fruits out there.
But why not bananas?
Bananas are really high in sugar.
It's also high in potassium.
That's
too.
true. That's true.
Better way
Yeah.
out.
So when I make a shake for my wife and I every morning, and in the blender I will put half of a banana, meaning my wife and I are sharing half of a banana. So I get a quarter of a banana in my shake. And I also put half of an avocado in the shake. That's a good fat, and it kind of thickens it up a little bit. I put water in it. I never put juice in there. I'll put a scoop of that Strauss yogurt in there, and I'll put organic blueberries, and then again, that little piece of banana, blend it up, and it's a wonderful shake.
And they get more sugar as they get more ripe.
Yes, they do. They get
Yeah.
sweeter.
Yeah.
Yes, absolutely.
Or can you put like spinach in there? any
Absolutely,
kind of
yeah, and then whatever
vegetable?
vegetable,
Yeah.
yeah. Sometimes
Yeah.
I'll put a thing of organic fresh spinach in there. Yeah, absolutely. Anything that's dark green, yes.
Do you think the frozen of fruits and vegetables are
They're
almost-
perfect, as long as they're organic.
Because if you're just cooking for one, it's
Right.
so.
That's mentioned in here somewhere. They can be frozen or fresh, but again, they need to be organic. Good question. Okay, again, there's the avocados. We use organic butter. We use the Kerrygold butter, which is really great. I use, in fact, in my coffee, I do bulletproof coffee. Have you ever heard of that?
Yeah.
Where I put organic unsalted butter in there and our MCT oil, medium chain triglyceride oil in there, and blend it up. I don't put half and half or any dairy in there, and it puts like a frothy head on it, and it really tastes very good. I don't use any sweeteners in there, and it gives you energy. Here's your oils, eating program. We talked about that. Boom, sweeteners. Now, some people have a serious sugar issue. They're really addicted to sugar. And in that case, what we do is we put them on an herb called gymnema. And gymnema, within a day or two, will knock down the most serious sugar cravings. It's really powerful.
Or the leaf, or the leaf stevia,
No, I don't like stevia. It's too sweet.
but it's not sugar, and it's not a sweet.
But it promotes that desire to maintain that sweetness. And so the idea is to get your body to where you're craving more bitters than sweets. Bitters are the foods that help to promote detoxification and immune system. That's why Brussels sprouts are so good for you.
Oh, you never.
What?
Brussels sprouts?
I love Brussels sprouts.
Not acceptable.
You can put a little bacon in there. Oh,
Well,
come on.
we've got an issue too, we have to watch out for pectin.
Yeah, okay.
Pectin.
All right, so everybody has something, but again, lots of water, avoid this stimulants that we talked about, the sugar cravings, the gymnema is listed there. You get rid of that, weight loss happens naturally. Portion, you're just gonna naturally have less of a tendency to overeat when you're doing this. Constipation, again, lots of water. And then if you have serious detoxification symptoms like headaches and that kind of thing that last, we do have a nutritional product we can put you on that can really bring those, what's called a Herxheimer reaction down, and it's our whole food B complex. can bring down detoxification symptoms really quickly. Yes?
If a person has parasites, doesn't it kind of nab all the good stuff out that you're eating?
Well, not necessarily. First of all, you know, if a patient does have a serious digestive issue going on, before I put them on the cleanse, we'll usually clean that stuff out first
Yeah.
and then put them on the cleanse. If a person has a serious digestive issue, they've been on antacids for a long time, then we'll kind of clean that up and then do the cleanse.
It goes for bacteria and parasites?
Pardon me?
The bad bacteria
Yeah,
and
yeah,
parasites?
Yeah, so, and again, we can muscle test for parasites too, and for candida and all that stuff, and for virus. So anyway, there's a way to get through it. I've helped so many people over the years do this. Water, lots of sleep, and you lose a lot of toxins through your perspiration too, so it's important to exercise so you break a sweat. That's how you get rid of toxins through your skin. And you're gonna have more energy, weight loss, better digestion, decreased bloating, clearer skin, healthier, shinier hair, disappearance of past conditions, a healthier you. In other words, the past conditions that you're being treated with medications for, a lot of times will disappear, so you have less of a need for the drugs. But that's not my job to determine that.
Blood vessel cleanser?
Pardon me?
Blood vessel cleanser?
Exactly, yeah, exactly. Okay. We just did this. So that's basically it. If you guys are interested, we have the cleanse kits here. We can get you started. You filled out your toxicity questionnaire. We'll collect those from you. And, and then we will check in with you along the way. If you're a patient already, I'm obviously seeing you regularly. If not, and you want to be a patient, then we can talk about setting up a time for an assessment and evaluation. Get you checked out and see what's going on. I'm so glad you're here. Thank you for coming.
Thank
Anybody have any
you.
questions before we wrap it up?
So how much are those?
The whole program is $349. Covers all the products and all the support you get through the entire program.
For the 21 days?
Yes.
And that's the initial consult and evaluation too?
No, that's a little bit separate, but I discount that for people who are starting this. So I would do that for $149. That includes all of the assessment, the muscle testing, everything we do, including a couple X-rays if they're indicated. We were running that special through last year, but if you're doing the cleanse, I would offer that still. It's actually gone back up to $289, but I would do it for $149 for you.
Before inflation?
Yeah, right.
So you do the chiropractic also then?
If that's something that's
Is that
indicated.
something that you need?
Yes.
Yeah, and do you take insurance?
We don't, but we provide super bills that you can submit to your insurance company for reimbursement. A lot of people have either Blue Cross Blue Shield or
Do you Medicare?
oh, Medicare does cover some chiropractic care, and yes, we do bill Medicare. That's the only one that I legally have to be contracted with. But these other ones, they usually have really high deductibles anyway.
Yeah.
But Medicare, none of the insurance companies cover the alternative nutritionals.
Right, right.
They only cover a limited number of chiropractic visits.
Right.
So we do the assessment first, and Medicare doesn't pay for the assessment either.
Correct.
Or X-rays.
Right.
And then we sit down, we give you a report of findings, that's all included, and then tell you what we recommend for you and decide the best course of action, tell you what we think Medicare, what we know Medicare will cover of that, and then we discount the portion that's not covered by Medicare for you.
Oh, okay.
Yeah, so we do have lots of Medicare patients, and so we're very familiar with how all that works.
Okay, thank you.
You're very welcome.
Okay.
Any other questions? Thank you.
Thank you, yes.